Hi, my name is Annalena Zúñiga and I'm going to talk about vitamin D supplementation during pregnancy and the prevention of childhood asthma. Asthma is a chronic or long-term condition that intermittently inflames and narrows the airways in the lungs. The inflammation makes the airways swell. Asthma causes periods of wheezing, chest tightness, and shortness of breath and coughing.
Have hypersensitive airways. Their lungs react to things that may not bother other people. Asthma can cause significant changes within the airway, all of which narrow the opening, making it difficult to breathe. This is how the airway looks in an airway without asthma. The airway is pink and clear, with no interior swelling, and the muscle bands around the airways are not tight. There is no mucus overproduction. Air moves freely through the open airway. Untreated or poorly controlled asthma can cause changes in the airway that may be irreversible. When you have asthma, three main changes can occur in your lungs. The first is inflammation. This makes airway tissue irritated, red, and swollen. When you have asthma, inflammation is always there, even when you are not experiencing symptoms. When the tissue becomes inflamed, the airway narrows and airflow is decreased. The second change is bronchoconstriction. This is the tightening of muscles that surround your airways, further reducing the opening. The third and final change that occurs is an increase in the secretion of mucus, which further blocks the airway. When someone with asthma comes in contact with an asthma trigger, such as pollen or tobacco smoke, one or all three of the processes, inflammation, constriction, increased mucus production, can occur, all of which contribute to the narrowing of the airway. This is known as an asthma attack or episode.
Vitamin D supplementation may be effective in preventing the transient forms of wheezing that occur in preschoolers, but not allergy-related asthma, the prevailing form of persistent disease during the school years. Unlike school-age asthma, transient wheezing is unrelated to allergies and the most common cause of wheezing regardless of prognosis in this age group are viral lower respiratory tract illnesses. A previous report showed significant effects of vitamin D supplementation on the developing immune system, and it is thus possible to surmise that during the first 3 years of life, vitamin D supplementation may decrease susceptibility to viral infection, and has been shown in a recent clinical trial involving older children.
According to a new study, women who take vitamin D supplements while pregnant decrease the risk of asthma and respiratory infections in childhood. For the study, researchers at King's College London examined the effect of taking a supplement of 4,400 IU vitamin D3 a day during the second and third trimesters of pregnant women compared to the recommended daily intake. Researchers add that blood samples of babies from mothers who were given a higher dose of vitamin D3 later in the study had boosted immune systems. A statement released from King's College said this week, "For the first time, we have shown that higher vitamin D levels in pregnancy can effectively alter the immune response of the newborn baby, which could help to protect the child from developing asthma."
Pros. Vitamin D supplementation provides protection against wheezing illnesses. This protection is strongest in the first year of life and tends to wane between the ages of 1 and 3 years. Vitamin D supplementation may decrease susceptibility to viral infection. Cons. Not effective in preventing school-age asthma.
So we are interested in looking at vitamin D levels in kids with asthma and allergies, as well as potentially looking at mechanisms for vitamin D's effects on the immune system. The clinical data that we obtained showed a couple different conclusions. One is we saw that low vitamin D levels were very common in kids referred to National Jewish. The second part of our clinical data looked at features of asthma and its relationship to vitamin D. And what we found is kids with lower vitamin D levels tended to have lower levels of lung function, as well as several increased measures of allergy, such as the amount of IgE antibody in their blood and the number of positive skin tests that they had. We also found, in terms of the medications that we were looking at in kids with asthma, that kids who were taking more steroid medicine, either inhaled or via an oral form, had lower vitamin D levels. In the lab, when we took immune cells and bathed them both with steroid medications as well as vitamin D, there was a greater anti-inflammatory effect than when either of those was used alone to suppress immune cells. This data is very exciting because it has a couple potential implications clinically. One is that if vitamin D helps augment steroid medicines, people who have low vitamin D levels, if supplemented, could potentially need less of these medicines. So vitamin D has the potential to have what we call a steroid-sparing effect. Whether it does or not is really unknown at this point. The next step in investigation really needs to see if vitamin D supplementation leads to lower levels of medicine use, better lung function, and better asthma control.
Vitamin D deficiency and insufficiency has been associated with asthma occurring in children. A cross-sectional study of 3,003 infants in Ecuador showed that risk factors for recurrent wheeze include daycare attendance, a cold in the first trimester of life, and maternal smoking during pregnancy.
I'm going to just tell you a couple things about vitamin D supplementations. Okay, so the first trial I looked at was there were 24 trials of over 5,000 participants who took vitamin D supplement at about 2,000 units per day, and they saw a 30% reduction in small for gestational age size babies. You know, you could take a vitamin D supplement and reduce your risk of your baby being abnormally small for gestational age. And 2,000 units a day is sort of a standard dose, so I don't think there's anything unusual about that. And then the other study to tell you about was about 1,200 women who took vitamin D preconception. And they looked at the vitamin D levels in these women, and they saw the outcomes and compared them for people who had adequate levels of vitamin D versus inadequate levels of vitamin D. And what they found was in the group of women who had appropriate levels of vitamin D, they had decreased risks of miscarriage, increased probability of actually getting pregnant and having a live birth. So, you know, here's another example of sort of a normal dose of vitamin D improving outcomes in pregnancy. So I do think that evidence is mounting for people to take vitamin D supplementation preconception as well as while you're pregnant. And it does appear that it's going to help improve outcomes. So I do think that's a good idea. I'd say I recommend it.
Conclusion. Although supplementation was not effective in preventing school-age asthma, vitamin D supplementation during pregnancy may still play a role in averting less persistent forms of wheezing in infants with a paternal history of asthma and allergies. In spite of its good prognosis, transient wheezing can be associated with severe asthma, especially during the virus season.
And have had lifelong seasonal allergies, and out of the blue they start having wheezing and cough and shortness of breath, and they're sort of stunned to find out they have asthma. But the two conditions coincide in each individual, so it's very common. Asthma is at its root is twitchiness or spasticity of the airways, so it goes from normal to very constricted very quickly. So asthma is characterized by intermittent symptoms. Day to day doing fine, then they'll get a respiratory illness and they'll have a lot of prolonged coughing, wheezing, shortness of breath, and may even end up in the emergency room or hospitalized. But it's a very, very manageable condition, and I should emphasize that people who have asthma and don't smoke cigarettes will never die of respiratory failure or have COPD like you see in the commercials.